Is there anything more frustrating than not getting sleep? When we lose sleep, we can feel grumpy, disorganized, confused, and just plain tired. It can be really discouraging to have sleep problems in the middle of your cancer journey. Let's talk about how cancer changes sleep and what actions you can take to sleep better. When we cannot get to sleep at night, keep waking up, or do not get good quality sleep, we feel sleepiness as our bodies try to catch up on rest. Both people with cancer and their allies report sleep problems, much more than folks without cancer. It is really common because of increased pain, the effects of chemotherapy, radiation, medications, and surgeries. So if you're going through one of these things, expect to have some difficulty sleeping. Another thing that can get in the way of sleep is worry. Worry about treatment, worry about cancer, worry about the future. For all these reasons, it is normal to have sleep problems after being diagnosed with cancer. The good news is that there are some proven things you can do to sleep better. Here are 3 approaches to getting better sleep. You can use all 3, or whatever combination makes sense to you. Number 1 is sleep hygiene. Sleep hygiene refers to changing our behaviors and environment to get better sleep. This could be lowering the light levels in your home when the sun goes down to cue your brain, time to sleep. Avoiding looking directly into light sources, especially ones that stimulate your mind, like a smartphone or TV, is helpful. Try to get on a schedule, going to bed at the same time every night. If you're a caffeine drinker, avoid consuming caffeine after 2 p.m. Keeping the room that you sleep in cool and comfortable helps most people sleep. Try to keep your bed reserved for only sleep and intimacy. If we're watching TV in bed or having deep conversations, our brains get confused. Bed should mean sleep to our brain, not the best rerun of your favorite TV show or delving into the mysteries of the universe. The second approach targets thoughts and feelings. This can be a big one. Maybe you've laid down in bed and 100 things pop into your head. Listening to something relaxing, like a guided meditation or soft music, may help. If you find yourself thinking about things you need to do tomorrow, try writing them down so that your brain knows it is taken care of. Every time you think about the to-do list in bed, remind yourself, I wrote that down. I'll see it and take care of it tomorrow. Routine exercise, approved by your medical provider, is important to build into your schedule as it helps with sleep. A tired body is usually more able to fall asleep. Your mood can affect sleep. If you feel depressed, anxious, or can't stop thoughts getting in the way of sleep, talk to a therapist about this. Talking about your problems during the day may help you feel better about them at night. The third area is medication. There are prescriptions, over-the-counter drugs, and natural supplements that may help. Talk to your cancer medical provider about how these things can help you sleep. They do not solve all sleep problems, and not all medications will be appropriate in your particular medical situation. So it is usually recommended to add in the sleep hygiene and psychological tools we talked about before, even if you are using medications. Most people can get better sleep. It is not hopeless. Try some of the approaches I mentioned. Talk to your medical provider at your next visit, or ask to see a provider here in the Psychosocial Oncology program.